Hello, class. We're going to finish up our lecture this week, and I do apologize for being delayed. We have one more lecture on next week, and then that will be it for the balance of the course, and we'll be coming into home base in terms of course completion. So we'll get right into our chapter. Our chapter this week is on chapter 11. Health Information Exchange, a very important chapter. Our learning objectives are to illustrate why the health information exchange is a positive step for healthcare. We will describe the roles and the functions of the HIM organization and the health information exchange efforts. Explain the concept of interoperability and its importance in healthcare. Learning objectives 2, juxtapose the benefits and the barriers of HIE, compare and contrast the models and methods of HIE, explain the requirements of meaningful use. And as always, I will post this on the homepage under the syllabus, the entire PowerPoint. I'll get through as much of this as I can today. All right, the formal agreed upon process for seamless exchange of health information electronically between providers and others with the same level of interoperability according to nationally recognized standards falls under the umbrella of health information exchange. It requires a shift in mindset for most healthcare professionals. This is based on treating individuals singly or singularly versus being within a group practice or facility. It's further in terms of how we understand healthcare organizations and their impact on the entire healthcare community. Now let's talk a little bit about a practical health information exchange that you probably have utilized. And the most common that you will see are generally governed at the state level. And I believe that is particularly because of the funding that was given during the Meaningful Use Days of 2011. This was the big onset of health information exchanges as well. And so the funding at the state level gave the jurisdiction at that level to establish HIEs. And for the most part, that is still the case. Each state, if they have an HIE, it's governed by your state. Now, whether it's under public health or what entity, that might vary, but it's governed by your state. Now, in the state of Illinois, we have a health information exchange that has expounded and expanded. Actually, we have one that is through the state, more private individuals are in that group. Then we have one that is expanding and expounding through the Veterans Health Administration. And so your typical profile of a health information exchange will be patients who have listed or agreed upon via written authorization to have specific components of their health record to be part of the health information exchange. And typically, this information is limited. So what is the reason for health information exchange? At the end of the day, the reason is to improve healthcare outcomes through timeliness and data sharing of information relative to that patient. Prior to health information exchange, what would we do to gather information? from a facility? Well, we would start by trying to validate if this was for continuity of care or what the case was in terms of a release of information. Oftentimes, because of HIPAA, even though the criteria for continuity of care is that it's not necessary or needed, oftentimes facilities are still reluctant to actually disclose that information, and they still want an authorization on file. It does happen. And so what the HIE has done, it has precluded some of these bottlenecks or barriers to disclose information based on the fact that certain relevant information will be maintained in a software package at the state level so that that information can be shared with a specialist potentially, or it can be shared with a pharmacist or whomever the patient has authorized this information to become available and disclosed to. And that's kind of the quick and dirty of it, if you will. There are different levels of HIEs because some HIEs come with patient portals and access. Some are just limited where the patient doesn't have access. So this will vary based on the size, the scope, and complexity of the facility. All right. Value-based healthcare is an evolving concept which focuses on better care for the individual, better health for the community, and then lower cost of healthcare improvement based on the services and delivery methods. All right, now we go into the phases of the HIE level 3, interoperability. It's the capability of different information systems and software applications to communicate and exchange data or information. Must be both internal and external applications, and it can be difficult to achieve. This is so true. Now, why do you think there is a challenge in interoperability? Well, there has to be interfaces of various systems, correct? All right. Now, if you don't have an existing interface, then someone has to adopt an interface with your system to meet my system. So we are on the same network, if you will. Okay. Now, if that does not exist, that has to be created, that interface. And so there's a cost associated with that. So if you can recall the days of HIPAA, when we had over 600 billing methodologies in terms of transactions to transmit billing, well, this is the same thing in HIE. You have all of these various networks, all of these various programmings that have occurred, but yet they are not aligned. And so you have the necessary interface that must be created, or the ability to be on the same network. All right, so unless those two things exist, then it will be a challenge to synchronize all these various healthcare information systems. There are 4 types of interoperability. Technical is based on hardware and equipment, connectivity used in exchange. It allows any computer or device to exchange data with another computer or device without corrupting the data or creating errors. And that's the goal of interoperability. All right, continuing on with the 4 types of interoperability. Syntactic is message format standards that identify how data is formatted or structured to allow exchange. It can require interface software, as I just spoke of, that must be employed for compatibility to enable exchange. These interoperability standards are not specific, only to healthcare, as they are applied to any electronic transmission between entities. And then we go from syntactic to somatic. And this is what I thought this was initially. But the second one is somatic. The first is syntactic. The somatic process involves the use of standardized terminologies, such as SNOMED CT. And so if you can recall, SNOMED was a coding nomenclature that was used years ago, right? And so it has other capabilities, not only in the area of coding, but it is a nomenclature. It can provide clarity, consistency, and appropriate meaning in HIE. And it's still undergoing development. Process, this is at level 4, interoperability. It's the most difficult of all types of interoperability. It can process, this process refers to the degree in which integrity of workflow can be maintained between systems. It includes maintaining and conveying information, such as your user roles, data protections, and system service quality systems. And then 4, HIE, American Recovery and Reinvestment Act, ARA, was enacted to stimulate the US economy during a recession. It's dedicated to expanding the use of HIT to improve business efficiency and effectiveness of healthcare organizations while increasing patient safety, health outcomes. And of course, high tech. And this is more or less one of the recent laws that was enacted as a result of technology and its impact. Health information technology for economic and clinical health was a $19 billion dedicated funding dedicated to health information technology. It involved workforce education and training, certification of EHR systems or products, establishing standards and vocabularies, driving electronic security and privacy regulations. Now, another thing that this high tech has done that you might not be aware of, it actually facilitated apprenticeships for a lot of people. However, the difficulty of the apprenticeships being awarded through AHIMA, and then AHIMA actually was working at the state level, was that there was difficulty in obtaining sites that met the eligibility requirements for the apprenticeship. So not only do you need the technical aspects, you need the hardware, the software, the EHR, et cetera, you need labor, correct? Yes, you need skilled technical labor. And so to fulfill that gap, that was the approach that was taken of apprenticeship programs. Foundational HIT legislation included development, adoption, and promotion of electronic and computerized applications to create an interoperable health information exchange system. This added new regulations and requirements. It toughened enforcement. It increased penalties for security breaches and privacy violations. And so here we did find in high tech that there is some strengthening of security breaches and privacy violations. And at the same token, we do have some strengthening. There is some part of the high tech that laxes somewhat HIPAA provisions as well. History of HIEs. HIEs are typically a public-private partnership, as I said before. Organizations that oversee, govern, and facilitate transmission of healthcare data between different types of HCOs that have various EHR systems, and therein lies the problem again, according to nationally recognized standards. All right, there are local regions of health information organizations in terms of HIE, and then there are regional health information organizations. So a group of organizations with a business stake in improving quality, safety, efficiency of healthcare organizations or delivery that come together to exchange information for these purposes. And so you can have a collaborative effort between a local and a regional HIE, and they're often used interchangeably in terms of the terminology. But LHIOs typically, again, on the smaller scale. And I just want to piggyback for 1 second here, because when we were speaking of HIEs in terms of public and private partnership, in terms of interoperability, this also brought to mind the fact that everyone is going on an EHR system. And of course, although everyone is automated or seeking to become automated, they may be in a hybrid status. There are problems that lie in disclosure of information and health information. Reason being, even though you might be on an electronic system, when you are needing to disclose that information, it's typically still produced on paper, large volumes of paper. There are some exceptions. We have gone to digital formatting in some instances to disclose information electronically with encryption, and then a two-system auto authentication system process. But for the most part, it is still produced in paper. So the question had been raised often, well, we have all of these electronic health systems. Why can't we get to the point that we just disclose electronically, everyone? Well, this is the same system problem of interoperability. Until we all can be on the same system or network, or we all have the interface with other facilities, we will still be forced to produce paper. Even though we've taken all of our efforts to become paperless, we still have to reproduce the paper, send it out for disclosure, and then the recipient, if it's in a healthcare environment, they have to do what? Scan that paper into their EHR. So you see the gap there that exists in terms of us really being able to come together to bring a seamless EHR network together as a one unit. That will take some time, but we are fortunate enough to be able to work toward that end. Some of the concerns and risk as we do this is to be able to make sure we assess appropriately our confidentiality, our confidentiality safeguards and protections in terms of information system security. Because once we do reach that plateau, and we will eventually, we will definitely have to have a robust monitoring system to assess any potential breaches. Because once you hit that button and disclose that information, you cannot unravel that disclosure. All right. So what I'm going to do here, I'm going to stop and complete our discussion, our lecture for this week. I'm going to let you finish up. Sequoia is the next topic that you would want to take a look at, and that's on slide number 18. So have a great evening. Enjoy the rest of your evening, and bye for now.